Hello Medicos, welcome to our YouTube channel, The Exploring Medico. I will be teaching your pathological portion. Last class we discussed about reversible cell injury. Today we discuss about irreversible cell injury. So, irreversible cell injury is persistence of injurious agents causes irreversible structural and functional damage to the cell. It includes necrosis and gangrene. So, necrosis necrosis is irreversible cell caused by irreversible cell injury. It is rapid pathological death of group of cells amidst living tissue. It followed by degradation of tissue by hydrolytic enzymes caused by ischemia, physical and chemical agents, bacterial toxins, and immunological injury. Types of necrosis: coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis, and fibrinoid necrosis. Coagulative necrosis. It is the most common type of necrosis caused due to ischemia. Affected organ are heart, kidney, and spleen. Area of such ischemic necrosis in an organ is known as infarct. Grossly affected area is pale, firm, swollen, yellowish, softer, and shrunken. Microscopically, cytoplasmic and nuclear details are lost due to coagulation of cellular protein. Cytoplasm is brighter pink. Liquefactive necrosis. Liquefactive necrosis due to ischemic injury to brain and bacterial infection and degradation of tissue by hydrolytic enzyme. Morphology or grossly affected area soft, liquefied, and center containing necrotic debris. Microscopically, cystic space is containing cell debris and macrophages. Cystic spaces are corresponding to dilated glands filled with proteinaceous fluid. In case of brain, cyst wall is formed by proliferating capillaries, and in case of abscess cavity, cyst wall is formed by proliferating fibroblast. Caseous necrosis, it is seen in center of foci of tuberculous infection. Combined features of coagulative and liquefactive necrosis. Grossly affected organ soft, yellowish, and has got cheesy look. Microscopically has got eosinophilic granular and structureless appearance surrounded by tuberculous granuloma. Fat necrosis, special form of cell death occurring at fat-rich anatomic location in the body. For example, traumatic fat necrosis of breast and mesenteric fat necrosis due to acute pancreatitis. In fat necrosis, there is a hydrolysis and rupture of adipocytes causing release of neutral fat which change into glycerol and fatty acids. Grossly appears as a yellowish white and firm deposits formation of calcium salts. Microscopically cloudy appearance surrounded by an inflammatory reaction. Fibrinoid necrosis, it is characterized by deposition of fibrin-like material encountered in autoimmune vasculitis and autoimmune disease, arterioles in hypertension, and peptic ulcer. Microscopically, brightly eosinophilic fibrin-like material deposited in vessel wall surrounded by nuclear debris of neutrophils. Gangrene, it is defined as death of a part with putrefaction superadded due to action by saprophytic bacteria seen on skin surface, bowel, lung, mouth, and cervix, and etc. Two main types: dry gangrene and wet gangrene. Variant of wet gangrene is known as gas gangrene. Dry gangrene begins in distal part of a limb due to ischemia. For example, toes and feet of an old patient due to severe atherosclerosis of arteries. Causes: Bur- Berger disease and Raynaud's disease. Berger disease affects blood vessels, mostly arm and legs. Raynaud's disease is small arteries that supply blood to the skin constrict excessively in response to cold. Affected part: dry, shriveled, and dark. Wet gangrene occurs in naturally moist tissue and organs. For example, diabetic foot. High glucose level in necrosed tissue favors bacterial growth. Bad sores in bedridden patient due to pressure on sites like sacrum and heel may spread to peritoneal cavity, causing peritonitis. Gas gangrene, special form of wet gangrene caused by gas forming clostridia which gain entry into the tissue through open contaminated wounds. Clostridia produce various toxins which produce necrosis and edema locally. Affected area swollen, edematous and painful.